agree?
I wanted to ask about New York City declaring a public health emergency as it relates to monkeypox over the weekend. Does the administration generally support local municipalities taking this kind of action as they see
A local jurisdiction? It's for them to figure out what's going on in their own community. They know best of what's happening on the ground, so we leave that to them. I do want to add, so because we do have some news on the vaccinations that I've mentioned, the JNOS vaccination that was announced last week on Thursday. 737,000 vaccines are out. As I'm speaking in front of you right now, they're being shipped to areas that really need them. And so, if you think about the 737,000 and the 300,000 plus that we have put out, that puts 1.1 million doses that's out in the United States. And so that matters. It's very important as we're trying to really have a aggressive approach to dealing with monkeypox. On testing, and I don't know if folks had this, but we are doing testing about 80,000 tests per week, and that's another important, significant way of making sure that people are getting tested so they know if they have monkeypox or not. And lastly, and I've talked about this from here already, which is the education, which is the outreach, educating public health officials and activists out there, making sure that they know exactly what to look for and what the treatment is, and so that as well continues.
Do you have any insight on the president's own thinking right now on the possibility of declaring a national public emergency on this? I know he'll obviously be advised by folks around him, including Secretary Becerra, but what does he think?
So when it comes to a public health emergency, that is a decision that is made by Secretary Becerra. That is not made by the president. But as you know, we are considering every policy option to help end this outbreak. That is urgent and that is important to us. But again, that is up to Secretary Becerra to make that decision.
Any general timeline?
I would refer you to HHS on a specific timeline.